For seniors with sleep apnea, the thought of a CPAP mask can be stressful, especially with claustrophobia. But what if a treatment existed with a 90% patient compliance rate compared to just 50% for CPAP? That huge difference exists because many people find CPAP machines difficult and uncomfortable to use. For seniors, the feeling of confinement from the mask is a primary reason for abandoning treatment. Here we will break down the most comfortable and effective CPAP-free options available for you today. First, let's establish why finding a treatment you can tolerate is absolutely non-negotiable. Untreated sleep apnea dramatically raises the risk of high blood pressure, heart attack, and even stroke. This is why a comfortable alternative is so important. The leading CPAP-free option is oral appliance therapy. These are custom-fitted devices, much like a mouthguard. They are silent, portable, and completely mask-free. Doctors often consider them a first-line treatment, particularly effective for mild to moderate sleep apnea. So you know it's comfortable and effective for many. But how does it keep your airway open without forced air? The device works by gently repositioning your lower jaw. This slight forward shift prevents throat tissue from collapsing. The key is that it stops the blockage from happening. It avoids a sealed mask, removing the source of claustrophobia. One study found something remarkable for seniors. Oral appliances improve daytime sleepiness, which CPAP did not. So it's not just a tolerable option. It can be more effective for improving your daily quality of life. Oral appliances are a fantastic solution for many. But what if your sleep apnea is more severe? Is there a high-tech solution that works from inside the body, removing the need for any external equipment? Yes, it's called hypoglossal nerve stimulation, or HNS. It's an FDA-approved implant for moderate to severe cases. Think of it as a pacemaker for your tongue. While you sleep, it sends a gentle pulse to your tongue muscle. With each breath, the stimulation moves your tongue forward, keeping your airway open all night with no mask or hose. The results are impressive. 80 to 90% of patients see significant improvement, with over 90% long-term adherence. We've covered custom devices and internal implants. Now let's look at powerful options that don't use a device at all. For some, apnea is worst when on their back. Positional therapy uses pillows or sensors to encourage side sleeping. You can also strengthen the muscles causing obstruction. Myofunctional therapy is exercise for your tongue and throat. Finally, never underestimate foundational changes. Weight management and avoiding alcohol before bed can have a huge impact. Even a small amount of weight loss reduces fatty tissue around the neck, which can lessen airway compression. So we have devices, implants, and therapies. How do these pieces fit together to prove the initial claim? Go back to the core problem: claustrophobia and discomfort. Every single option discussed here removes that barrier. Remember that 90% compliance rate? That number is the direct result of designing treatments that work with the body. Something else to know is that treatment is needed even without loud snoring, which can be absent in seniors. The evidence is clear. You have choices. So what is your next step to better sleep and better health?